started at Children's Hospital in 2004. The intention was to integrate art throughout the hospital to create a healing environment. So we have artwork that is donated by artists within the community. We also have artwork that's created by our patients and children in the community. Every mid-winter camp, we have students from the ArtsCorps Art as a Social Practice class that come and assist. And this is a mosaic that was created during one of these camps. And it's called the Tree of Hope, and kids from ages 6 to 16 created it. And they worked all day long, and they worked through their lunch hours because it was so much fun. And I think it gave the students an opportunity to see the importance of integrating art into different support group situations. This is a piece based on the Mexican milagro, and milagro meaning miracle. So at our camp, we work with our patients to create their miracle or their wish or their hope or their dreams. Children's Hospital of Michigan has been involved with the Art as a Social Practice class since its beginning. We were one of the first community partners. Through this program, we've been able to work with students who have created a variety of projects. Some artwork stays at the hospital, and other projects are to develop programs for the Healing Arts program, such as a self-guided tour of the art collection for families that are waiting.
The project that I did with Children's Hospital was through Maine Jackson's Art as Social Practices class. We discussed placement, and I wound up being placed with Children's Hospital as my community location, where I discussed with Grace the idea of doing a large tile installation. When I first met with Grace Sarah, she had said that Children's Hospital, one of their sayings was it takes a village to raise a child, so the same should apply for healthcare, and that it takes a large collective of people to help heal a child. So taking that, we decided that that was a good route to go. Students were given a single tile, so they had no idea what the overall image was going to look like. And they were given a color palette, warm or cool colors, so essentially reds and yellows and blues and purples. And they decorated individual tiles, so it was their own individual artwork.
Working at Children's Hospital, we have limited resources, but it doesn't mean that we can't offer our patients the very best of programming. And working with the youngest and brightest students provide an opportunity for us to bring programming at times when they need it the most.
Working with the patients was very interesting because as children, they're not judgmental, and allowing them to be distracted from why they were there, and just the response we got from their parents and how happy they were that their kids were actually seemed to enjoy doing something. So I think it was a mutual experience where I think all parties benefited.
It's a wonderful program that really teaches people who are young that they have a lot that they can give and that they can make a big difference. Some students are interested in working with our patients directly, doing art making programs. Other students are interested in bringing their expertise. I'm really interested in working with students that we can address both of our needs, that it's something that they're interested in doing and will learn from, and something that benefits the program.
A lot of times they have people come into Children's Hospital, they have musicians and they have other artists come in, and a lot of, it's easier to get materials involved in more 2D work such as painting or paper craft. Music, you can bring instruments in and out, but something like clay, you'd need a firing facility. So it's a lot harder to get that involved with the patients, so we figured we would take advantage of the link between Wayne State and Children's Hospital to use the clay facilities, and one of my concentrations in fine arts is ceramics. So I already had a base knowledge of how the project was going to go.
I recommend the class to students and to community partners. It's been a really wonderful program for me. I love working with young people because our patients are young, and I think that what they bring, this youthful spirit to programs here, is much different than what I would bring to programs. I think for community partners, I'm always telling them about the wonderful projects that students have developed at the hospital, and many of them continue to work with me on programs.